All right, we are live. And welcome back, everyone. My name is Tim McMahon. I'm Director of Marketing here at St. Joseph Hospital. And this is part of our weekly Meet the Experts series, where each week we interview one of our experts here at the hospital in one of many departments to help you understand more about what we offer, the services, the treatments. And today it's actually a little different. Today is focusing more on our kind of our business and health services. And with us today, we have Colleen Heaslip, who is our corporate health consultant for our new WellnessFirst program. So welcome, Colleen. Thanks for joining us.
Thank you for
And
having
we'll
me.
be going through and asking Colleen some questions that we kind of commonly get about WellnessFirst, since it is a brand new program. And we want to make sure that you as an employee or employer have all the information you need, certainly to contact Colleen after this broadcast with more questions. So we're going to jump right into it. Colleen, let's just start off. Why don't you just kind of introduce yourself and the WellnessFirst program? Just a quick overview.
Sure. As Tim said, my name is Colleen Heaslip. I'm the corporate health consultant here at St. Joseph's. And a part of my job is developing relationships with employers in the community and introducing a new program that we launched a few months ago called WellnessFirst. It is complimentary for employers and is targeted to help employers improve the health and wellness of their employees through St. Joseph's Hospital and programming. So a few key highlights of the program is it has a 24/7, 365-day-a-year care coordination line where an employer, an employee, or a family member can call in, receive assistance with finding and setting up a primary care appointment, any specialty care or follow-up appointments as well. It also assists employees working through any workers' comp or on-site injury, works them through the whole process. And it also comes with employee programming, so helping employees understand their health benefits from their provider and any on-site wellness and health events as well.
Okay, great. Thank you, Colleen.
Yeah. I hope
So like I
that
said,
did
we have
its
a few
justice for
questions.
you, Tim.
What's that?
I hope it did its justice, my little.
Yes, absolutely. So like I said, we have a bunch of questions that we kind of commonly receive about the program. And you may have kind of hit on these in your opening statement, but that's okay. We'll just kind of go through them again, just so folks who are watching or just tuning in right now can kind of get the full scope of WellnessFirst offers to our community. So the first question was, tell us about the WellnessFirst program. You just did that, so I'll skip over that one.
I got a little excited, Tim. I had to jump right in.
Yeah, no problem. So, can we tell us more about the 24/7 care coordination line? So, and maybe start with, an employer joins the program, and then what happens?
Sure. So the care coordination line is actually one of the main highlights of our program. I like to describe it as a concierge service line that helps streamline and assist employers and their employees into the St. Joseph's network. A really nice feature that we both just said was it's 24/7, 365 days a year. So as many of us work during business hours, we may not have the time or think about, okay, I need a primary care doctor. I need to make that appointment. I have a really weird ache in my elbow that I've been ignoring for a couple of months. And, the work day's over and on to the next day and you forget about it. You could call this line, after dinner, after you put the kids to bed, you can call this line and they can assist you directly into getting you into St. Joseph's to schedule those appointments for you. As I mentioned earlier, it also helps with any workers' comp injuries an employee may have. So this line can assist with working with adjusters, working with any paperwork, working with our providers to get them treatment as fast as possible and back to work as fast as possible as well. So it is a really great feature of the program.
Great, thank you.
Yeah.
Now I'm gonna jump a couple of questions ahead here.
Sure.
I think this is kind of a key feature, and you've said it, but I just want to hone in on it. Is this program really complimentary?
Yes, it is complimentary, and that is something I love to tell employers. So the care coordination line is complimentary. providing education for employees on their benefits and any wellness education and health events is complimentary. I do want to note, just with any service within a hospital setting, you know, there may be some insurance deductibles or out-of-pocket pay, but the program itself is completely complimentary.
Okay, so with that in mind, if the program is complimentary, does an employer have to sign a contract, or do they have to commit to something? How does that work?
No, again, there is no contract. While we would love for all the employers in our program just to utilize St. Joseph's, it's not mandatory. What we do is we collect information from the employer about any protocols they have in place, kind of go over all the different service lines of the program, and we just encourage them to try it and take our business, but it is not something that they have to commit to.
Okay, so an employer hears about this program, they're interested, they know it's going to help their employees, overall wellness. It's going to save them money on workman's comp and things like that, and they contact you and they sign up, and it's totally free. There's no contract, and once they sign up, all their employees have access to all these things instantaneously.
Yep, so it is instant. As soon as the employer does decide that they want to partake in our program, I would simply educate them about the care coordination line. That is, like I said, the main feature in the program, and they would instantly have access to all of our service lines.
That's great. So another question that I'm sure some of our employers, our local employers, might ask is, what are the benefits for an employer to enroll in this program?
Sure. So
why would they want to?
Yep, there's many benefits, but a few highlights would be we complement what the employer is already doing for wellness in the work sites. We're not looking to compete with anything that they have in existence. It's just an added benefit to the employer. The program really focuses on creating a healthier and more productive workforce. And as a result of that, you can see controlling benefit costs and lowering workers' compensation claims and injury results as well. So it's a trickle effect, and it gives a lot of benefit for an employer.
Great. And then, the next question obviously is, so what are the benefits to the employees? So I know that, St. Joseph Hospital, our employees are part of this program. So maybe talk initially from, the perspective of, our St. Joe's employees, and then again, thinking about other company employees as well.
Sure. So a benefit for a St. Joseph employee is I'm currently speaking at all new hire orientations. So I know it's kind of an overwhelming process, learning all the different departments, learning about your benefits. So a key thing that can help employees is educating them about their benefits. And part of my job is doing that. And through that, letting them know about care coordination and helping them, like I mentioned before, finding a primary care physician, setting that appointment up. Any specialty care, for example, think about, are you utilizing your yearly mammogram or any other specialty service testing? They can call directly through care coordination. So I always point that out as a major benefit to employees as well.
So once an employer, signs on in the program, you'll get all their information about, the insurance products they offer and all the whatever's included in their benefits plan, so that an employee who is part of that organization, when they call you or when they call the care coordination line, the folks there will have all their information and they'll know exactly what they have access to and that sort of thing.
Yeah, that's correct. So the care coordination line, really, we want to streamline and make it easy as possible for employees, and their family members. So I do collect their insurance, workers' comp information, any pre-hire, physical requirement or drug testing. That way care coordination has it all in front of them. And we're not chasing back to the employer saying, hey, your employee got injured. Who do you have for health insurance? We really, like I said, we want to make it as easy as possible. And especially with workers' comp, we can get started right away on working with those adjusters and the paperwork. So yes, everything is streamlined, and we really want to take off the stress from employers, especially HR. They handle a lot of this stuff, and it can be really overwhelming.
And that way the employee doesn't even have to call the hospital or the practice, right? I mean, the folks at care coordination will book those appointments right for them on the spot, correct?
Exactly. And care coordination works with the employee and the employer, so they don't have to wonder what's going on. There's direct communication from care coordination.
That's great. All right. Another question we get is this program mostly focused on occupational health?
So occupational health is one service line of the program. It's not the only focus, but a really nice feature that St. Joseph's has that other hospitals may not have is an on-site health occupational clinic, and it really easy access to labs, radiology, cardiology, all in one location. So any enrolled employee in the WellnessFirst program, they can request a pricing proposal, and I'll gladly send it over about, any physical pricing, DOT physicals, or any other occupational services they're looking for.
Great, thank you. All right, going down the line here.
Yeah.
Is an employer required to participate in all of the program service lines?
So employers are not required to participate in all of our service lines. Part of my job as a corporate health consultant is developing relationships with employers and helping them pinpoint what areas of the program work best for their employees, whether it's all four or, one here and there. And then even as they go, they may decide, for example, hey, we would love to utilize you for our pre-hire physicals.
Great. Let's see. I have two more questions for you. And then, of course, folks who have watched these presentations before, this is live. So if you have a question while you're watching, this Meet the Expert series, feel free to post it in the comments. I'll see it right away, and we'll ask your questions live on screen so that Colleen here can answer them for you in the moment. Of course, if you have questions after the fact, feel free to post those in the comments section as well, and we'll do our best to get back to you on those later. All right, so next question is, if employees aren't already established in the St. Joe's network, are they eligible to use the care coordination feature?
That's a really good question. I actually get that quite a bit. So once an employer is enrolled in our program, all their employees have access to care coordination. In fact, care coordination's function is really to help tie the employees to our network. So whether they have insurance through their employer or through their spouse, they will have access for care coordination.
That's great. And I think we already kind of talked about this, but is this a program, a contract? So we talked, is it, do you have to sign a contract? And I think you already said that there are no contracts, correct?
Correct. So we would just be, like I said, meeting to find out any protocols they have, of course, promoting St. Joseph's and hoping that they utilize this for business. But even, if they sign on and they're only utilizing one service line, I meet with them yearly to decide, hey, we didn't go with this service line, but is this something now that your employees would benefit from?
Great. So let's assume that a prospective employer is watching this right now or later and is interested in the program. How do they get set up? How do they get in touch with you?
So they can reach me. If you want them, I can say my email right now and they can email me, and it's just simply setting up a call or an in-person meeting and we can have that discussion and they'd be enrolled instantly.
Okay. And Colleen, what is your email?
chcheaslip@covh.org.
Great. So I'm putting it right at the bottom here of the screen.
Perfect.
So if anybody wants to contact Colleen, learn more, just to learn more about the WellnessFirst program, send her an email right there, cheaslip@covh.org, and she can explain all the ins and outs to you. I know we only covered a relatively small portion of the program in today's broadcast, but hopefully it gave folks a decent overview of what WellnessFirst is, what it offers to our communities, to our businesses. One more question that I forgot to ask that I think people will ask is, is there a certain size of company that you have to be in order to be eligible for the program? Do you have to have a certain number of employees? Is there a minimum or a maximum?
Sure. So we are, open and willing and want to talk to any employer of any size. I think there can be benefit to any employer enrolling in the program. But if you're asking me like what our sweet spot is, it's really, 50 to 100 or larger employers. But like I said, any interested employer, feel free to reach out to me. We definitely can work through and decide how the program can benefit you and your employees.
Oh, you know what, Colleen, we actually just got another user comment or question rather. Can you talk a little more about on-site wellness programs?
Sure. So that's kind of my part of the program as a corporate health consultant. I know COVID has thrown a wrench into a lot of, wellness offerings that employers are currently doing. But it can be anything from a virtual lunch and learn. It could be, doing a biometric screening, helping employers plan their health events. We have a mobile health clinic here at St. Joseph's, so I've been kind of tag teaming and, bringing on the clinic on site. We can do flu shots, physicals. I mean, there's tons of different services we can offer through the mobile health clinic. But that's kind of a little menu of some of the things that we can do for wellness for an employer.
Great. And of course, if someone were to reach out to you with questions, we have flyers and things like that we can send out to folks with more information about those types of programs. Okay.
And the programs are very customizable too. I want to add that in there. While we do have a menu of, for example, presentation topics, if there's something specific that your employees are telling you, hey, due to COVID, like I'm really stressed out or whatever it may be, we can really customize our programming to the employer.
That's great. Fantastic. Well, I think we are kind of at our time limit for today. Again, thank you, Colleen, so much for joining us and talking all about the WellnessFirst program. I think, like I said, I think this gave us a great overview. And to our employers in the community, we look forward to hearing from you and working with you. And again, please contact Colleen at cheaslip@covh.org with any questions you have about the program. And again, thank you, Colleen.
Thank you, Tim. Thank you, everyone.
All right. Have a good one, everyone.